Wisconsin reaches a crisis point. I'm Matt Smith. Today on Upfront, Governor Evers extends the mask order and offers new bills to help people during COVID-19. I'll ask state Senate leaders what, if anything, lawmakers are prepared to do. Plus, Adrian's interview with Dr. Anthony Fauci.
This is not fake news. This is not a conspiracy. This is a real, serious disease.
And recount 2020, the process, precautions, and why a lawyer for President Trump says he can still win.
Taking on the issues important to Wisconsin. This is Upfront with your host, Adrian Pedersen.
Hi, everyone. Thank you for joining us. I'm Matt Smith in today for Adrian, who will join us later in the program. But we begin with a dire warning about COVID-19. The Wisconsin Hospital Association says COVID-19 will go from a crisis to a catastrophe if state leaders don't act. The WHA is calling on state leaders to work together. In a letter to the governor and top lawmakers, the WHO said significant, swift, and unified action is needed. COVID cases, hospitalizations, and deaths surged to new highs again this past week. Governor Tony Evers extended the COVID mask mandate into January.
It's time, folks. We do not get any do-overs here. Enough games. We need you to join the cause, and we need you to start today.
The governor also proposed a $541 million plan he says will help. But are lawmakers ready to act? We're asking the incoming Senate President, Senator Chris Kapica of Delafield. Senator, good to see you. The governor and some Republican leaders met Friday morning. What's going to be the result of this, and what needs to come from this meeting?
I think the meeting was really to have a discussion to see if there's common ground that we can come together on. Obviously, the citizens of Wisconsin have been speaking up saying, hey, we really want you guys to get together and get something done. So I think we'll get together early next week just to have the discussion as the leaders from both the houses and then the governor had the discussion. We'll find out kind of the result of that.
Will Senate Republicans support anything the governor put forward in the past week?
Yeah, there's actually a couple of ideas in there that we looked at and said, hey, this is a good idea. We've got a couple of ideas around, protection of legal liability for schools and for churches, nonprofits, places of employment. We want to make sure that would get into any package so that there can't be frivolous lawsuits. So there's a couple of things that I think we can probably work with to try and put a package together. We're not sure on the timing of that. The timing could be this year yet. It could be early in next session. I think that's part of the discussion as well.
The Wisconsin Hospital Association sent you a letter and other leaders this past week saying the healthcare crisis in the state without action will become a catastrophe, pointing to ICU patients 4 times higher than 2 months ago. They want a legislative mask mandate and more regional hospitals. Is that something you're going to do?
So one of the things we're looking at is so that their point on regional facilities similar to the one in Milwaukee. What we're doing is looking at, and it's called by HERC, but it's basically by healthcare region. We're looking at the ICU beds, the percent that are filled with COVID patients right now, and then, hey, what other capacity do you have out there? And we're seeing some of the major systems right now actually start to reduce their elective procedures to give more capacity and also look at that overflow capacity that a lot of them have in their plans. Once we get our arms around that, we'll be able to better assess, hey, what is the actual need? And then is there something that we can do to put a facility in place if necessary? So that's definitely part of the discussion.
If the state Supreme Court overturns the governor's mask mandate, do you support the legislature backing and proposing a statewide mask mandate?
There's differing opinions in the legislature right now. So that's a discussion we're having as a Senate caucus. Obviously, I can't speak for the assembly, but we're having those discussions. Right now, our focal point is related to the mask mandate is the ability of the governor to does he have the authority to actually issue the emergency order? And that's been our concern from the beginning, is the governor doesn't have the ability to do that per the Supreme Court rulings.
In just the past week across the Midwest, Iowa's Republican governor issued a statewide mask mandate, limited indoor gatherings, closed bars at 10 o'clock. Ohio's Republican governor implemented a 21-day curfew. Why haven't Republicans in Wisconsin acted to slow the spread?
Well, if you look at what's happening right now, people understand the risk. We're talking about this a lot, and the Republicans in the legislature have had a lot of discussions as we watch the numbers. ICU beds has always been my thing. I've been very public about that. And as we see that continue to increase, we continue to talk about, and we want to say publicly, listen, number one, follow the guidelines that are out there. We know that social distancing, cleanliness, that type of thing does work. Limiting yourself to, when it comes to larger gatherings, if you can limit that down, it's been shown that's where a lot of the spread is happening. So those are things we're talking about, and we want to continue to have those discussions because obviously we're concerned as the numbers continue to rise. Besides
the health crisis, you could be facing a money crisis if Congress fails to act by the end of the year. The governor's administration said $466 million from January to April to cover CARES Act costs if Congress doesn't act for testing, hospital system surges, vaccine infrastructure. If Congress doesn't act, how much of that $466 million is the Senate Republican caucus willing to spend?
Yeah, there is definitely a concern with where's that money going to come from. So the governor put it out and said, hey, these are additional spending items that he'd like to see, but there's no funding source for that, and there's no accountability around it from the legislature side. So that's obviously a concern of ours. So we'll have to take a look at that. I think that's part of the discussion that happened on Friday. And we'll have a discussion as a caucus when we get together early next week. What's the alternative if Congress and the state doesn't act? Does this fall on municipalities, or does testing just go away? Well, I think that we'll have to figure out what we're going to do as a package. So remember, there's a lot of different things that we're looking at right now to help out the healthcare workers. We've got a great flexibility on licensing in place right now, and that's been part of the hospital's request is help us out by continuing to give us the flexibility for our workers. So we're definitely looking at things like that again, all of us can get around and help the hospitals out because they are saying, hey, we're concerned about the issues right now. A lot of discussions ongoing. You are the incoming Senate president. We appreciate your time, Senator Chris Kamiga of Delafield. Thank you. Thank you. Here's some of the details of the governor's new plan. Some of his ideas include requiring insurers to cover COVID-19 testing, diagnosis, treatments, prescriptions, and vaccines, allowing the Department of Health Services to prohibit evictions and foreclosures through next year, and continuing the suspension of the waiting period for unemployment benefits. Democrats say the Republican-led legislature has waited too long to act. We're talking now with Senate Minority Leader Janet Bewley. Senator, good to see you. The governor met with Republican leaders on Friday. He called the meeting productive. What needs to come from that meeting?
We need to actually get on the floor and pass some legislation is what has to come of that. There's been conversations. There's been things said back and forth. He won't meet with us. They won't meet with me sort of thing. But what really has to happen is they have to meet with a willingness to follow through. And if it's just a matter of, oh, yeah, we've reached a conclusion, but then we never get to the floor, what's the point?
The governor's proposal that he put out this past week included some numerous issues, including unemployment, evictions, foreclosures. How, though, does this get to the heart of the issue and stop the spread and the dramatic rise in cases and deaths that we're seeing across the state?
I think one of the most important things that it does is that it picks up on the expiration of so many of the features of the CARES Act that were put in place before. And without anything that we can do without CARES money, if the feds won't do it, we have to do it. We probably should have been doing more all along, since, of course, not a penny of state money has been allocated new money for anything having to do with COVID. The only state money that's been spent on COVID is something that was already in the budget. We added no new state money, so we have been completely dependent for money on the federal government. We made the changes that we need in law in order to be able to accept it. But truly, the state did nothing. This is our chance.
It doesn't seem like Senate Republicans have the appetite for at least the $466 million the governor referenced between January and April. Is there a compromise in here, or what happens if no funding is passed and Congress doesn't act?
Well, I would hope that that would be a number that would be pleasing or at least acceptable by them. In the range of things, it's an appropriate number. It is not a number that should make anybody faint away. It's the right thing to do. Now, what we have to do, it's the same conversation. Are you, Republicans, willing to come to the floor and do something now? That's the real question.
Coming up, Adrian's interview with Dr. Tony Fauci.
So I would hope that virtually all the population gets vaccinated. If we do that, we'd be able to crush this outbreak.
The timeline for a vaccine next.